Welcome, and thank you for joining us for the RSNA 2024 Radiology Reimagined demonstration. Hi, I'm Alicia Dami from Stanford University Medicine, and I'll be your guide for this introduction. Artificial intelligence and adjacent emerging technologies continue to make strides in radiology. AI can transform healthcare and address both computer vision and non-diagnostic tasks. RSNA has organized this demonstration under the direction of the Radiology Informatics Council to highlight ways that AI is already impacting the care we provide, to show how AI and other emerging relevant technologies will change the way radiologists work, and to explore what is needed to deploy and maintain AI effectively. As part of this demonstration, we again invited vendors of imaging, reporting, and AI systems to showcase tools that are currently in use or coming soon. Vendors were assigned to specific roles based on their capabilities and organized into 3 functional teams around fictional clinical scenarios. In each scenario, from the perspective of a radiologist, we go through several tasks aided by AI and supported by evidence-based care and diagnostic radiology. These tasks span the radiology workflow, from pre-acquisition to post-processing to reporting. Such tasks include faster protocoling and image enhancement at the pre-acquisition stage, the use of an AI orchestrator to integrate all AI tools, prioritization of work lists, as well as overlays on images for segmentation or completing measurements. Let's take a look at sample ways AI can improve the radiology workflow. Prior to image acquisition, AI facilitates protocoling, making it faster and more consistent. At image acquisition, AI aids in the reconstruction of MR images, an intense area of research. Algorithms aid in enhancing MR image resolution, reducing scan times. An essential component for successful AI implementation is the AI orchestrator, or traffic cop. The orchestrator streamlines integration of AI tools, making sure the correct imaging exam is presented to the right AI model. The AI orchestrator returns the results to the correct system. Another way AI can enhance radiology workflow is automating the prioritization of reading work lists. Interpretation worklist managers consolidate input from variables including workload and radiologist availability to allow timely review of results for urgent findings. Finally, the AI results are presented to the radiologist to review, edit, and accept or reject. AI results can include overlays such as segmentations or measurements on an image. AI results, such as ARIA findings or PI-RADS assessment categories, can also be sent directly to the report. The patient scenarios in this demonstration were designed to showcase actions for both acute and non-emergent findings. These cases demonstrate how using AI can improve efficiency of evidence-based care throughout the radiology workflow. You are about to participate in one of 3 scenarios: OB ultrasound and PE workup, prostate MRI with radiology pathology correlation, and ED trauma to ARIA workup. As you progress through our clinical stories, please excuse inconsistencies as we assembled imaging from several real patients. Additionally, some of the products that you see are either prototypes or still under development. Assembling the demonstration underscored the crucial role of interoperability standards and frameworks such as DICOM, IHE, and HL7 FHIR for the effective deployment of AI in an integrated workflow. These standards facilitate exchange of image annotations, findings, measurements, and assessment categories. Semantic standards, such as RSNA's RadLex, common data element modules, and RAD report templates help ensure clarity and interoperability. We are about to begin with one of our 3 clinical scenarios. Please remain seated for the live demonstration, and welcome to Radiology Reimagined.
Hey everyone, good afternoon. Thanks again for coming. Moving on to our second clinical scenario today. My name is Jason Edelberg. I'm a 4th-year resident at Mount Sinai in New York City. And today we're going to talk about a clinical scenario entitled Primary Care to Prostate Cancer. Just 2 quick disclaimers. So for the purposes of this demo, the images may not line up perfectly, and that's okay because they're taken from real-life actual patients. And secondly, this demonstration will be about 10 minutes long. Again, please hold questions for the end. And at the end, we are very lucky to have multiple very knowledgeable technical representatives here. Again, these are not salespeople. These are people who are intimately involved in the development of these products. It's a really great opportunity for you to ask questions and have a direct conversation with them. Okay, so on to our story here. So here we have an 85-year-old man, Mr. Frank. Mr. Frank went to his PCP recently, received a digital rectal exam, and was found to have a nodule. He was found to have an elevated PSA level as well. So his primary care provider ordered an MRI of the prostate. Now, as us radiologists know before, the MRI of the prostate is done, first has to get has to get protocoled, much to our chagrin. And with the protocoling of our MRI prostate exam, we can use the GE Intelligent Protocoling tool to help us with this. Intelligent protocoling aggregates historical imaging exam information at the enterprise level, and at the same time connects to the HL7 FHIR system via HL7 FHIR to different hospital information systems to collect the patient's clinical information, such as PSA, presenting symptoms. This information is combined as input to a machine learning algorithm, which then suggests the appropriate protocol automatically. This intelligent protocoling algorithm learns from historical selections as well by users for each exam and accumulates a lot of data over time. It continuously adapts to the site practice as more and more exams are being used and being performed. Now, once the scan is performed, the MRI images are captured and they arrive in PACS, which in this case is the Paxera Ultima 9th generation. In addition, behind the scenes, we have the Interlinx interface engine, which serves as the glue connecting all these tools seamlessly and effectively. Interlinx uses current standards as well as machine learning to optimize and simplify imaging data movement and interoperability. In addition, Interlinx can anonymize, transform, or filter the DICOM data, and it can send the examination to our AI machine learning tool here, which is the Siemens Healthineers AI Rad Companion Prostate MRI tool. The output from our AI machine learning tool is viewed in the Fovia AI Cockpit, shown in our screen there on the left. So the AI Cockpit effectively bridges the gap between AI algorithms, PACS, and reporting systems. With this tool, you can easily review, annotate, validate, modify, accept, reject, and segment AI results in 2 and 3D for more accurate and reliable radiology findings. This particular example, so we have our prostate MRI, we have our AI results there on the left, and the Siemens Healthineers AI Rad Companion, which is going to show us a PIRADS 5 lesion in the right anterior transitional zone there in yellow. The radiologist can interact with this finding, so if we disagree with the measurements, we can tweak the calipers, basically sort of change some of the results in that way. In addition, as you can see, the AI algorithm has done segmentation for us, so it's segmented out the prostate gland. They're in the pink-purple color. And there's some other features as well. So if it detects a suspicious lesion, it can go ahead and it can segment out the lesion itself, can characterize it so it can classify it due to its different PIRADS level, PIRADS score. In this case, we'll go ahead and we'll agree with the finding here. So we'll click there on the left. If you follow the mouse, we'll click to agree with it. We'll accept the finding. This finding is then exported by the Interlinx AI orchestrator to our smart reporting smart reports for report generation. So these findings are received again by the Interlinx system as a DICOM SR, and then it's routed to the PACS as well as converted to FHIR for downstream systems like the electronic medical health record. Now, disseminating these findings into multiple downstream systems like PACS, a vendor neutral archive, reporting. So it's another area where a product like Interlinx really shines. Again, this can enable tighter integrations and increased interoperability. Now back to our report. So here, our PIRADS 5 lesion has been auto-populated into our report. So the AI system, with the help of the other systems, as well as just created a report for us that we don't have to manually dictate ourselves. And this will reduce the burden on the radiologists with less manual work. Our report now contains the lesion, the prostate gland volume, the PSA value, and the PSA density. And it's just there when we open the report. So we don't have to put any of that into it ourselves. Okay, let's move on to the next part of our demonstration today. We're going to talk about coordination of care. So a lot has happened to Frank since we first met him, and coordinating his care journey, which includes now oncology appointments, imaging follow-ups, and infusion treatments, requires seamless access to information at every step. This is facilitated by PocketHealth, assisting Frank with his imaging journey by centralizing his imaging records, reports, and follow-up recommendations is this tool. This includes educational material, reports, and follow-up recommendations all on one platform for Frank. You can see that Frank's reports from Smart Reporting are easily accessible for view there in PocketHealth. PocketHealth also simplifies medical jargon by using simple visual aids to define clinical terms, as well as organ visualization, and all this helps Frank make sense of his reports, resulting in a better understanding of his diagnosis and treatment. There are other features that are useful as well, PocketHealth. So These features include follow-up reminders. There are suggestions for questions to ask his doctor right there. And then there's also easy record sharing with friends, family, and care teams. Now, throughout the course of this demonstration, you might be wondering how this is all running so smoothly. Well, a lot of communication is going on behind the scenes with different applications. You may have noticed that all these different applications, including the PACS, image viewers, and reporting, they all open correctly to the same patient. That's possible by using DICOM and FHIR. These are standards that synchronize clinical applications to a particular patient in a specific study. Also working behind the scenes are Enlitic Ensight and ENDEX. Ensight uses natural language processing and computer vision algorithms to review information from DICOM, pixel, and text metadata. This identifies key attributes of radiological exams like standardization for detecting and redacting any sensitive information like PHI. The ENDEX module is used within a customer's DICOM processing workflow to provide standardized metadata descriptions for DICOM studies. Now, the output of this functionality is used for various healthcare workflows like workflow improvements, billing, and research. For the last part of our demo, we can talk about the ACR Assess-AI. We covered this last time. But in brief, again, this is a system that we can use to track the performance of our AI systems over time. So I think that closes our second clinical scenario for today. And thanks for your attention.